Okay, coffee chat. I have a question because I'm seeing it more, and I don't know if it's because the stigma of it is changing or what it is, but can we talk about gynecomastia? I feel like it's an elephant in the room for a lot of men. Talk to me about it.
Yeah, gynecomastia is male breast enlargement, and it's not just fat. It could be glandular tissue, usually under the nipple.
And it can hurt.
So, you know, there are multiple reasons why it can happen. It can just be related to age. So, you know, actually newborns have it because of the maternal effects of estrogen.
Oh, wow. Okay.
Mom's estrogen gets into the, you know, the baby, and the baby male, and basically causes a benign breast enlargement.
Okay.
So, you know, we're not operating on
babies.
Right. So that's just part of hormonal influence. So gynecomastia has multiple causes. Sometimes it's related to hormones, estrogen, testosterone imbalance. You know, in addition, it could just be in adolescence. So the teenage years, puberty, hormonal changes. And then usually, again, in late adulthood for males. So as testosterone levels drop and there's an imbalance of estrogen and testosterone. So it's like newborns, during puberty, and then older age.
Men, I feel like, are really sensitive about it. And the patients that I've spoken to about gynecomastia with sometimes don't even really want to talk about it.
Definitely.
You know, and I think that the first step is always consulting with a surgeon and knowing what your options are, right? And so what if a patient were to come in tomorrow to talk to you about gynecomastia, what would you tell them? What are their options? And obviously we're starting with don't feel bad for coming to me about this, right?
Yeah.
Like, what do you think?
Yeah, so the first thing is to make sure there's not like a medical or medication induced reason for it. It's like, why is this happening? So, you know, it could be related to age and just a natural process, but also it could be related to medications such as anabolic steroids, which, you know, a lot of males may be on, but that's kind of, you know, an unwanted side effect is
the development of breast tissue.
Yes. And so that can be bothersome. People start to hide it more, put on shirts, don't want to expose their chest. So, you know, first thing is make sure there's no other medical reasons. Sometimes it could even be a tumor within the body. It could be related to medications, like we chatted about, but also cannabis use can cause male breast enlargement as well. So there are many reasons for it. But number one is like doing this algorithm and understanding, like, do you have a tumor, or is it related to a medication? Is this just kind of part of your genetics and hormones? So it really comes down to that conversation.
And then
first.
if it does result in specifically breast tissue and there is no underlying reason other than this is how my body developed, or I've been off that medication for 10 years and I now have this as a result of it, what are my options?
Yeah, so the options are: one, observation. One option is always doing nothing. Two, it could be if there are any offending agents, to stop them, or to understand why it happened. And then three is there are surgical options. And so sometimes it's liposuction. That's usually a combination treatment. That's not usually the only solution. And sometimes it is offered by providers who don't understand really the pathophysiology of gynecomastia, because really it's about glandular tissue under the areola that's like firm, it can be painful. Liposuction isn't going to address that typically.
So what are the combination surgical approaches to resolve my concern about gynecomastia if I had it? Yeah,
so if it's a very focal area under the areola or in the general vicinity, one approach is called a periareolar approach. So we make an incision around the areola, which is the pigmented skin around the nipple. And then through that hole, which results in an inconspicuous scar, we're able to kind of excavate the surrounding tissue and kind of scoop it out. And so then you have like an amazing aesthetic result because you get rid of that firm, glandular, painful tissue under the nipple, and you have a great appearance. But not everyone's a candidate just for that surgical scar, because if you have a lot of excess skin and you have a lot of extra fat or other tissue under there, you may have to do a complete surgical incision, like a double incision type approach.
And that leaves a scar essentially from the side of the chest wall here all the way through, or?
Yeah, usually it depends on how much extra skin and tissue there is, but we're ellipsing out the tissue and then closing it to be kind of flat, but not scooped out or hollowed or divoted, because you kind of want to reflect natural anatomy, and but the scar can be long, but we try to mirror it along natural anatomic contours.
Interesting. Okay, so but there's options.
There are options,
right? And so I think that if you're a patient who has been concerned or even ashamed, right, of what this conversation looks like, don't be. Gynecomastia is not so uncommon and rare that we shouldn't be able to talk about it. Right? And as specialists here at Breast Surgery Group and Top Surgery Specialists, we're the perfect people to be talking to you about this. In fact, sometimes gynecomastia can be considered a medically necessary procedure covered by insurance. I will say, as a patient coordinator here, the parameters for gynecomastic coverage are like wild. Like sometimes there's like a tier of like stage 1, stage 2, stage 3, and I think even stage 4. And on average, you have to be a candidate within like beyond stage 2, I believe, for insurance to cover it. But the first step for that is having a consult. And at that consult, you'll meet with Dr. Vias. And Dr. Vias is going to make you feel so comfortable that you don't have to worry about anything beyond just talking about what your solution to your issues are.
Yeah, it's all about feeling comfortable in your body, feeling confident, getting back out there, going around shirtless. And then, obviously we want to make sure there's not a medical issue that's causing this as well. So I think it's important to get checked out.